Hello dear students, welcome to Pharma Ignite channel of LG Institute of Pharmacy, LG University. My name is Disha Joshi. I am working as an assistant professor in Department of Pharmaceutical Technology and today I am representing LG Institute of Pharmacy, LG University. The topic of today's video is intrauterine drug delivery system as well as intrauterine devices. So this topic is included in the subject of novel drug delivery system. The subject is of bachelor's in pharmacy and semester 7. So the code of the subject is BP701TP, which means you will be having theoretical as well as practical sessions for this particular subject. Now, before starting with the unit that is intrauterine drug delivery system, you should know that what are certain other type of drug delivery system are included in your curriculum. So, starting with the controlled drug delivery system as well as sustained drug delivery system, then you will also study about transdermal drug delivery, gastroretentive drug delivery, and nasopulmonary drug delivery system. Then comes targeted drug delivery system, which means how a particular medication which is having poor bioavailability as well as poor absorption issues can be targeted at a particular site of action. So it is about targeted drug delivery system, which will include nanoparticulate as well as vesicular drug delivery system. Then comes ocular drug delivery system. And besides all this unit, one of the unit which you will study today in this video is intrauterine drug delivery system. So let's begin with the presentation. The contents of this presentation will be introduction part of the drug delivery system, that is introduction about intrauterine devices. What is your understanding about intrauterine drug delivery system and what is meant by intrauterine devices. Then comes advantages as well as disadvantages after using this drug delivery system. Then you will study about developmental phases of IUDs. IUDs is nothing but intrauterine devices. So what are the various developmental phases? What is the historical background of intrauterine devices? When was this first intrauterine device term was coined and by which scientist? And what are the various advantages of using this first generation IUD and why there is a need to develop third generation IUDs which is already available in market in today's date. So that further topic is connected to types of intrauterine devices where you will study this first generation, second generation and third generation IUDs. Then you will study about applications of intrauterine devices. So let's begin with the introduction part. So in the simple language, what is meant by intrauterine devices? As the name suggests, intrauterine, that means a device or drug delivery system where drugs has to be targeted into the uterus and certain type of problems or disorders should be cured for the uterus. So, students, before starting or before diving into the topic of drug delivery system, you should know about uterus. So, the anatomy of uterus I have not included in this video, but we will just have a quick revision. Now, see, you have already studied about the anatomy of uterus and you already know that this particular organ is present in the female. Okay, so a uterus is the muscular organ, highly muscular organ of the female reproductive system, and it is divided into three different parts, that is fundus, then uterine cavity, as well as that uterine cavity encompasses the body of the uterus, then comes fundus and the cervix. Now this uterus is a pear-shaped organ. Okay, and the length of this uterus is about 7.5 centimeter. The uterus is about 7.5 centimeter long. So this information is very much important before developing a device which is known as intrauterine device. So the length of the uterus is important to No. Now talking about various parts of the uterus or uterine cavity, then above the uterine cavity, you will be seeing the fallopian tubes are present, and these fallopian tubes are interconnected with the ovaries. Now beneath the uterine cavity, there is a cervix, and beneath the cervix, vagina is present. So these are the basic parts of the uterus, and in more detail, if you want to study, then you can get certain type of videos available on YouTube, or you can also study about the anatomy of uterus from the subject, that is human anatomy and physiology, which you already studied in semester 1 of B Pharmacy. Okay, so this is the basic information. Now talking about intrauterine drug delivery system, which means we have to target drugs into the uterus, or specifically, we can say that this type of drug delivery system is mainly used for family planning, which means this type of drug delivery system or intrauterine devices is one of the method of contraception. It is the highly used method of choice for contraception by a large population. So now why there is a need for the development of this novel drug delivery system method or improved birth control method? Why there is a need to develop such intrauterine devices? So this type of device will be having long term action. They can release the medicament into the uterus, which is having contraceptive activity. They can release the medicament into the uterus for a prolonged period. So it will be having prolonged action, and this intrauterine devices can be used for the span of 1 month to the 8 to 10 years, which means it is having prolonged action when it is inserted. Once it is inserted into the female, right? So once this contraceptive method has the ability to eliminate the need for daily activity and for some specific action at the time of coitus, and this are designed to meet this all the criterias which are given already in the introduction part here on your screen, right? So there is a need to develop certain type of drug delivery system. And when we talk about the definition of intrauterine drug delivery system, so these are the controlled release, these are containing controlled release medicines, and it is having contraceptive activity. Now here the term progesterogenic activity is written, but I would like to mention that contraceptive activity is the more broader term which you can use in the definition of intrauterine drug delivery system. Why progesterogenic activity I am not using, that I will explain you in the later slides. Okay, so the definition is intrauterine drug delivery system can be used for delivering the medicine in the controlled pattern. It is having contraceptive activity, and it can show this contraceptive action for a prolonged period of time, and thus it is required as a method of choice for contraception. Now, moving towards the next introduction part, which is specifically about intrauterine devices. The previous slide was about the basic introduction to intrauterine device drug delivery system, and this slide is about intrauterine devices. So, what is meant by intrauterine devices? And as here, the first line is written about the anatomy of uterus, and as you all know, what is the physiological functioning of the uterus. So it is mainly involved in the menstruation, inducing labor. Then it is involved in the pregnancy as well as during delivery, right? So uterus is the most important organ in the female reproductive system. Then comes intrauterine device. So the device which is used to cause the contraceptive action and which is to be administered into the uterus is known as intrauterine device, and they are nothing but the artificial objects. They are small artificial objects or devices which are inserted into the uterus to prevent the occurrence of pregnancy, or we can say here the main mechanism of action of this intrauterine devices, it will prevent the process of fertilization, and thus further it will not result in the unwanted pregnancy. Okay, so this is the basic definition for intrauterine devices. Now, next is about what are the various features of intrauterine devices. So here we have already mentioned earlier that the length of the uterus is 7.5 centimeter. That means we have to design a device, intrauterine device, which is having the length that is smaller than the uterine cavity. So the length of the IUD, which is already designed and available in the market, is about 3 centimeter. And further talking about the shape, then such device, as we have seen, the shape of the uterus is of pear shaped. It is a pear shaped organ, right? That means we have to select the device, the shape of the device, which can be easily fitted into the uterus. So what shape is available in the market? Then T shaped device is already available in the market. And I don't know if you already know that in market copper tea is available. That copper tea is nothing but the brand name for intrauterine devices. So you might have heard about this term copper tea, which is nothing but a contraceptive device, which is also known as intrauterine device. Right now, why copper is the metal of choice for using into this intrauterine device, for using in the design of intrauterine device? So as you can see here, copper will be having spermicidal action, which means it is having the activity of killing the sperms, or preventing it from entering into the fallopian tubes, or entering into or mating it with the ovaries, right? So copper is having this spermicidal action, and thus it will be having the contraceptive activity. And that is the main reason copper is the metal of choice for designing the for preparation of intrauterine devices. Now see that we will see earlier the types of intrauterine devices. Basically there are two types, that is medicated intrauterine devices and non-medicated intrauterine devices. Now as the name suggests, that medicated intrauterine device, which means it is having some type of anti-fertility agent, anti-fertility drug, so the anti-fertility drug is released into the uterus, and it will prevent the process of whole fertilization. And second type is non-medicated intrauterine device, that is a simple intrauterine device. Now what will be the mechanism of action, and what is the mechanism of action for medicated device, that we will see earlier. But here in the third line, it is written that some IUDs are also prepared by using hormones like progesterone instead of copper, but they have to be replaced once every year. So this example of progesterone is given for the medicated intrauterine device, which is containing anti-fertility agent, that is progesterone, right? Now, simple structure of intrauterine device. So these intrauterine device are inserted through the cervix into the upper tract of the vagina, and they are attached with the help of strings. That means during insertion, there are some type of strings which are attached at the bottom of the intrauterine device, and that strings are nothing but they are attached at the end of the intrauterine device, so that a doctor or a physician who is inserting this device into the uterus can easily locate the device, right? So this is all about intrauterine device, and the basic mechanism here, which I have already explained, that it will prevent the entry of sperm into the uterus, or we can say that it will prevent the sperm from meeting an ovary or meeting an egg. So this intrauterine device will basically, you have to only remember that intrauterine device will prevent the process of fertilization in the women. Okay. Now, what you can see in this slide is, on the left hand side, you can see that there is the location of intrauterine device, the orange circular part, and into the uterus you can see the intrauterine device is already inserted. Okay. Now see, here you can see the anatomy of uterus. At the lowermost portion there is vagina, up on the above the vagina there is cervix, and above the cervix there is uterine cavity, and the whole above part is known as uterus. Into the uterine cavity the IUD is administered, and see, now what to expect during an IUD insertion. Now this slide or this particular picture suggests that what is the procedure for IUD insertion, right? So basically, first of all, a doctor should know that what is the position of uterus, right? So and what will doctor do? They will simply perform an examination to locate the position of uterus, right? And to locate the length of the uterus, because due to different body parts, there are different types as well as the shape of the uterus or length of the uterus. So a doctor has to examine the location of the uterus, the position of the uterus, as well as he or she will also examine the length of the uterus. So first step is to locate the position of the uterus, which is known as bimanual pelvic examination. After that, the doctor will open the vagina as well as they will clean the area of cervix so that the position of the uterus is stabilized. Then comes the third part before inserting IUD. The fourth part is insertion of intrauterine device, and the third here before that the third part is there is a need to measure the length of the uterus. See, here it is given a sound apparatus is used to measure the length of the uterus as well as the cervical canal, which means what centimeter of intrauterine device has to be administered into the patient, right? And the last part is the intrauterine device is easily inserted into the female, and it is simply kept so that what see here you can see the strings. Wait, see, these are the strings. This whole portion is IUD. This is C-shaped IUD, and here the strings are attached along with the IUD. So the extra amount of strings are removed, but somewhat some small portion of string should be kept into here into the uterus. Why? Because when they are to be removed, at the time of removal the doctor should easily locate it into the uterus, and that is the main reason that a small portion of intrauterine string should be kept and the excessive amount should be cut out. So this whole slide represents what is the location of intrauterine device, how they are inserted, and what is the procedure of insertion. Okay. Okay, now let's talk about the advantages and disadvantages of using this intrauterine devices. What are the main pros as well as cons of intrauterine devices? So, students, the first thing which is most important, intrauterine devices can be used by any age group of women. Why? Because it is very simple to use. Okay. Now, next thing is it is a better option of contraception compared to the oral pills. Now, see, why such oral contraceptive pills are generally not recommended even by the physician, right? So, such type of oral contraceptive pills are having many type of disadvantages. First of all, dosing schedule. A patient has to compulsory remember the dosing schedule while they are using such type of contraceptive pills. After that, if a patient is having weak memory, then they will forget to take a medicine, and even if one dose is not taken by a woman, by a patient, then what happens, it will result into unwanted pregnancy. So this is the case with the oral contraceptive pills. But in comparison, what is the advantage? Once this intrauterine device is administered into the patient, after that patient's motivation is not required at all, right? So this is the main advantage, and it is the most important advantage we can say of using this intrauterine device. Then it is having immediate onset of action, and it is having less side effects compared to oral contraceptive pills. Now, for example, if you all know that once a woman has stopped using the oral contraceptive pills, for example, she is using oral contraceptive pills for a span of 3 to 4 years, and at one time she has stopped using the same, then what happens after one point of time, there are chances that a woman is not able to conceive further, right? So this is not the case with intrauterine device. After the use of intrauterine device has stopped, a physician has operated the patient and removed the intrauterine device. After that time also, a patient can easily conceive again, right? So this is the main advantage again. Then it can be also used by a nulliparous woman. A nulliparous woman is one who has not given birth to a live baby, which means she has not given birth to a child. So that a nulliparous woman can also use intrauterine device. So it can also be used by a breastfeeding or lactating women. Why? Because this type of intrauterine device has a longer onset of action, as well as it can have a prolonged release of the anti-fertility agent. That's why it can be used by any age group of the women. Then it can also be used by women who are already on certain medication therapies, such as a patient is already having diabetes medication, they are also having cancer medications. Then also this type of intrauterine device can be useful because it will not disturb the actual hormonal balance while they are on other medication therapies, until and unless a woman is having any another method of contraception. For example, a female is already taking certain type of contraceptive pills, then in that case intrauterine device should not be recommended, right? So this is the case. Then this type of process is reversible, as I have explained you earlier, that once the use of this intrauterine device has discontinued or the use is stopped, after that also a woman can easily conceive. The process of fertilization will be easily continued in the women, and such type of intrauterine device is cost effective, right? So these are all advantages which I have explained in detail. Next slide is about disadvantages of intrauterine device. So here the first mentioned disadvantage, which cannot be considered as a disadvantage, but here it is mentioned that insertion requires a qualified medical practitioner, which means intrauterine device cannot be inserted by a patient themselves, but it will require an expert who is knowing whole process of like insertion of IUD. So it should always be administered by a physician. Then it cannot prevent the risk of sexually transmitted diseases, right? So this is one of the demerit for using this intrauterine device. Then there are chances of certain uh, like reasons of menstruation, problems of menstruation, that is menorrhea, which means menorrhea is we can say menorrhea we can say as very much blood loss during periods. that is more than 80 ml of blood loss is occurred in the menstruation. So this is about menorrhea, which is one of the side effect of using intrauterine device. Then we can say dysmenorrhea is also the case, which is very painful menstruation periods. And polymenorrhea means that very infrequent periods, right? So these are all the side effects for IUD discontinuation. Once the patient has discontinued the use of IUD, then during menstruation, a female may possess such type of side effects. Then there are chances that after discontinuation of intrauterine device, after discontinuation of use, a patient may increase the risk of ectopic pregnancy. Ectopic pregnancy means whenever the egg will grow into the fallopian tubes, right? So that is ectopic pregnancy, and that is very much abnormal case. And in such cases, what happens? There are chances of miscarriage. So there, ectopic pregnancy is when the egg will grow into the fallopian tubes, right? So this is the main disadvantage. Now another disadvantage which is mentioned, that is higher risk of uterine infection or higher risk of endometriosis, right? So this is the main disadvantage. Or along with it also comes with other disadvantages such as menstrual cramps, which we have already seen here, painful menstruation periods. Then copper IUD is avoided in the case of Wilson's disease. Now, if a female is already suffering from a Wilson's disease, and Wilson's disease is a very like rare type of disorder in which what happens, so copper levels will build up into the certain organs of the female, such as more specifically in brain as well as in kidneys or in eyes. So copper levels will build up and such, and so that in such cases copper IUDs should be avoided by the female patients. So you can go for hormonal IUDs, right? So this is the disadvantage of copper IUDs. Then we can say hormonal IUDs. So they are not recommended for a patient who is suffering from liver disease or who is suffering from breast cancer. So in such cases, there is an alternative of using copper IUDs, right? So we will see certain types of IUDs in further parts of this presentation. Then there is risk of expulsion if the IUD is not inserted properly. Then there is risk of expulsion, that which means the intrauterine device can easily get removed by itself, right, from the uterus. Then irregular bleeding, that we have already seen here, this disadvantage of polymenorrhea. And in some cases, that is, this is very much rare, that after discontinuation of use, there are chances of endometriosis, heavy bleeding, or pelvic infection. Okay, so these are the main demerits, or we can say disadvantages, for using intrauterine devices. Now comes development of IUDs. Now we here basically in this slide the historical background of IUDs is given. So the first IUD was developed in 1920, which was made from the silkworm gut. The lining of the IUD was made up of silkworm, and which means it is nothing but a silk thread, right? And that silk thread was attached with a flexible metal wire, and that is the main reason the first IUD was a Grafenberg star. These are Grafenberg rings, and this is a Grafenberg star. This is Bimberg bow, and this is Ota ring. Okay, so these are the first generation IUDs which were developed in 1920s year. But the main disadvantage was due to the shape of the IUD. Due to its shape, they were withdrawn from the market because they were complex in nature. They were easily removed from the uterus, and it was like having intense pain while insertion, as well as there were chances of excessive bleeding, so they were discontinued. Then the second generation IUDs were plastic based IUDs. As you can see here, Margulis coil, this is Lippes loop, which was introduced in 1962. Margulis coil was introduced in 1958. So plastic based IUDs were made up of biocompatible polymeric materials, such as examples of polymeric materials are given, that is polyethylene, polypropylene, vinyl acetate copolymer, and silicon elastomer. But again, it came with the disadvantages. So what were the demerits of second generation IUDs? So they were a larger device. Now larger device means, for example, the length of the uterus is 7.5 centimeter. So it can only accommodate the object which is smaller than 7.5 centimeter. So this type of device was complex in nature and the structure was comparatively larger. Again, this type of structure is comparatively larger. So it caused discomfort to the women while insertion. It also caused endometrial compression, that is the contraction, as well as myometrial dilation, and ultimately it led to the uterine cramps, discomfort, and heavy bleeding, and thus they were discontinued from the market. Let's move to the Now, talking about the third generation IUDs, now we have already seen first generation IUDs and second generation IUDs and the demerits of the same. So, there was a need to develop third generation IUDs which will properly fit into the uterus, and there will be they will overcome the disadvantages of heavy bleeding as well as expulsions, right? Risk of expulsions. So the third generation IUDs is known as T-shaped device, which is also known as tantalum's T-shaped device, which was made up of a biocompatible polymeric material known as polyethylene. Now, this type of T-shaped device was smaller in size, which better fit into the uterine cavity, and it eventually overcame the problems which were listed for the first generation as well as second generation IUDs. So here is the picture. It is not visible here properly, but it is a T-shaped intrauterine device which was named as Tantum's T-shaped device because a scientist named Tantum discovered the structure of the device, right? So this T-shaped device easily fitted into the uterine cavity, and the size of the it also matched the size of the uterine cavity. That's why the convulsions as well as heavy bleeding were not possible in this type of third generation IUD, and thus it was used. But what happened in this? What were the demerits also for this T-shaped IUD? So unfortunately, it showed a few pregnancies. It was not having a proper contraceptive action, right? It was not having the proper therapeutic activity for contraception, and thus they were also withdrawn from the market. And then came the field of like copper teas, which was also known as new generation intrauterine device. So in research and development era, the new type of intrauterine device were discovered, which were medicated as well as non-medicated devices. Then this classification of medicated intrauterine device and non-medicated intrauterine device came into action, right? So copper bearing IUDs are one of the example, and in this copper IUDs, the example is copper 7. Now the number 7 suggests the dose of copper. 7 mg dose is incorporated in this copper based IUDs, and another one is medicated IUD, that is progesterone releasing IUD. It is sold under the name of Progesta Cert. So there are two types of new generation IUDs which are already available in the market, and it is used by a large number of patients, that is female population. So here we will stop our video, which includes about the introduction part of intrauterine drug delivery system. What is the advantage as well as disadvantage for using this intrauterine drug delivery system, and what is the historical background, that is first generation intrauterine device, which was Grafenberg ring, which was made up of silkworm gut, that is silk thread, as well as a metal wire, which was a flexible metal wire, and due to that it was having a circular ring like structure. Then the structure was different. It was a bow shaped structure, also a star shaped structure, also. But again, it caused discomfort. So there was a demerit also for using first generation intrauterine device. To overcome such problems, second generation intrauterine device was came into market, which was made up of polymeric material, but again due to the hard plastic material structure, hard plastic tail of the intrauterine device, it was also discontinued from the market. And then third generation and fourth generation, which is also known as new generation IUDs, came into era. So this is the basic knowledge for the intrauterine drug delivery system, and this is only one part of the video. I will prepare second part of the video. So in the second part we will study about design of intrauterine device, then types of intrauterine device. We will study types in detail, what is meant by copper bearing iodine, how many types of copper IUDs are there in the market, and how many types of progesterone IUDs are there in the market, and what are the applications. So please watch the second part of the video for full information regarding the unit intrauterine drug delivery system. Thank you so much for watching. If you have any questions, you can drop the comments in the comment box. Thank you so much, students.